Okay then. Well, thanks, John, for agreeing to have this conversation again. In this is sort of early part of January 2021, and specifically looking at pulmonary hypertension in the midst of a pandemic and where we're at in lockdown 3. John, I know you very well, and I know a lot of people that'll be listening to this have already seen some of the other infocasts that you've done. But could you just, for sort of clarity's sake, just introduce yourself, what your role is in pulmonary hypertension, and then we'll go into some specific questions and areas to look at.
Yeah, well, thanks, Ian. Thanks for inviting me back. It's nice to know that I'm wanted. Yeah, my name's John Wort. I'm the clinical lead for pulmonary hypertension at the Royal Brompton Hospital in London. I also chair the National PH Physicians Committee as well. So that sort of brings together all the centres in the UK.
Okay, and John, we talked, I think, right at the beginning of the pandemic, more or less in the first phases of where we're at, and now this feels, 10 months down the line, it feels quite sort of heavy and things like that. Can I just explain to people that might be watching this, John, that we're doing this live? You're at work at the moment in an office, so if somebody walks in, it's just one of those things. It's just one of those things. As long as you don't walk in half dressed or something, we'd have to explain that one. But yeah, present, and it's a really big question, this, John. Just try and sum up where you think we're at, and this is a national perspective. I know you work in London, and that's slightly different because of the sort of mass population down there. But where we're at the moment with the pandemic.
Well, we're in the second wave, aren't we? We're in the second wave, and we found that there's this new variant which appears to be more infectious, if you like, and we've entered this new lockdown to try and to cope with it, the increasing numbers and the strain that's been put on the NHS.
Mm-hmm.
And it does seem quite hard, doesn't it? Because we've been here, as you say, now for 10 months, and things were getting better, and now they're not. I think it's different though now, and hopefully we can discuss that during our time, because we've got a vaccine.
Yeah.
So we've got a way out.
Okay, so just in the context of that, I'm thinking, why is it different now? Because we've learned a lot in these 10 months. Well, globally we've learned a lot, but we've learned a lot, and we'll touch on those. You mentioned the vaccines, John, and again, very broad questions. The encouragement about the vaccines and how it's being rolled out. I know there's frustrations about it, but you talked about it as a potential way out eventually. Do you want to expand upon that?
Well, absolutely. I mean, I think it's been amazing, actually, if you think about it in terms of the 10 months, and globally, through collaboration of scientists and clinicians, we've come up with multiple vaccines that seem very effective. And that's just unheard of, isn't it? The work that's gone on to provide these vaccines that appear effective, and if enough people have the vaccine, and we all are sensible and comply with the government's advice otherwise, that is a way out of this about the situation that we're in. We may not get rid of coronavirus completely, but we'll be able to manage it, and we'll be able to live relatively near normal lives. So I think it's crucial. John,
can I just ask you from your perspective, we'll remain on the vaccine just at the moment, and I know not everybody's got access to it at the moment, but when people, particularly in our people, our population, people with pulmonary hypertension get offered it, there's not an insignificant number of people who have some concerns about vaccine. What would you say to those individuals?
Well, I understand that, and I mean some of those concerns are shared by people who haven't got pulmonary hypertension as well, because things have been pushed through so quickly, and so there's just the worry, isn't there? Of course, is it safe? Is it safe? Is it safe to have it? Have they cut corners? And I think, as you said, Mark Toshner did do a very good piece with you, and I remember seeing that, listening to that, and I think it's very convincing that actually there weren't any corners cut here, and it's safe. All these vaccines are safe, but yes, there are several of our patients have asked already, is it safe? Which vaccine should I have? I'm also on immunosuppression for another condition associated with my pulmonary hypertension. Is that safe? And I think almost inevitably the answer to these questions, unless you've got a specific allergy or reaction to vaccines, these things are safe, and it's really important that you get them. So we're recommending that all our patients, every patient with pulmonary hypertension should receive a vaccine.
Mm-hmm. Yeah, well, I mean, that's encouraging to hear again, John. I think people need to know that it's okay, because we're actually, I think one of the things that's different, well, I'm going to say one of the things that's, I was going to say something really stupid here, John. One of the things that's different with this pandemic is, because as if we've lived through another one, but we've got mass media now, we've got social media where sometimes there's rather than evidence being taught, I've heard that so-and-so, and then it becomes part of a story. So it's about ensuring that when you make decisions, make sure that decision is based on evidence. So, you know, we in pulmonary hypertension engage with our patients about lots of treatments. Now, people with pulmonary hypertension wouldn't not take a treatment without having a conversation with the specialist sort of centres or the GP or whatever, and the same sort of thing, not to be over influenced by the anti-vax people, which some of those is genuine concerns. I'm not somebody who's, and Mark sort of talked about this, Mark Tushner, in one of the infocasts, that, you know, we're not advocating that everybody must have the vaccine, but with pulmonary hypertension, what is the alternative? But it's your best care possible, without any doubt. There's little sort of doubt about that at all. I mean, so that's sort of encouraging. And could you just say something, John, as well? Because I know, again, on our social media platforms and things like that in the world of pulmonary hypertension, some people, there's obviously this criteria that's being used to roll out the vaccine. So at the moment, we're rolling it out with the really vulnerable, the over 80s, with other health conditions. Healthcare sectors and care sectors staff are being rolled out to give resilience to it. Just reassurance about this criteria, that I think with pulmonary hypertension, it's somewhere down the list.
I mean, I think it's in the fourth group, isn't it? At the moment, if I'm right, all these things change all the time. But the last time I looked, and I mean, the government have their reasons for coming up with that plan, and of course they have to think about the way the virus is spreading, who it's affecting, and I think it's reasonable what they said. And of course, actually, most of our patients, people with pulmonary hypertension, will be shielding anyway and keeping themselves safe. They've been very sensible throughout this period. It's been hard on them, of course, lots of strains put on them by doing it, and lots of benefit to the NHS for them doing it, of course, as well. But they are shielding, and I think it's probably about right what the government have come up with, you know, in terms of that.
Just to be sure, John, I'm not asking you to make a political comment here. There's got to be a rollout policy.
There has to be.
We can't do everything in one day. So
no.
It is what it is. And you're right. I think people with pulmonary hypertension, particularly another the sort of this. I feel a bit uncomfortable using this phrase, the clinically extremely vulnerable, but that's where these people sit. I've made a massive personal sacrifice to the NHS to protect it by this shielding type of thing. So when it does roll out, it'll roll out into those that population.
And people are already getting them. Some, you know, I mean, I think it does a little bit vary on their GPs, for instance, and so on. But some of our patients already have started receiving them, and so it does vary a little bit. So it's not far away, put it that way. So I think, you know, within the next couple of months, these vaccine, you should receive your vaccine.
Yeah.
And that we do. I was just going to say that, I mean, just some personal experience recently. Some of our patients they're still getting questioned about whether they're clinically extremely vulnerable. And what I can say is, you know, you are considered as that through the government's advice. It is sometimes difficult to see on the government website, because it doesn't say pulmonary hypertension, but you are there in those groups. And but if you have any problems, what I've done is I've written to the GP and saying, look, patient X is clinically extremely vulnerable, please consider them as that. So if you are concerned, get a hold of your centre and we'll help you out with that.
Absolutely. And I think the other bit to sort of support that as well, John, because I mean, centres be very busy as well, and you could be overloaded with a flood of those sort of requests. But using the PHA material on the website, and if you're really struggling, contacting Paul, Sean, or Helen in the office, pick up the phone. We'll provide that support as well.
Yeah.
It is frustrating. I think it's slightly concerning that there are some people who it's being questioned, but there is no doubt about it, and that's the situation. We can't solve that issue on that way, but we can certainly help and get it resolved in another way. That's really helpful. Just talking then, John, about in the present climate of where we're at and access to managing and to making sure from a pulmonary hypertension point of view that people remain as fit and well during this period of time on the third lockdown. How busy are centres, and are we really busy? Is it okay still to ring the centres up for advice?
Well, I mean, the answer to your last question is yes. Please ring, and we're open for business. All the centres are open business. We have meetings every couple of weeks where we have a kind of get together and work out what's going on. And there is variability variation across the country at the moment. Obviously, London's seeing more patients than the rest of the country, but it's going to shift like it did last time. So our centres are all open in London, and we are restricted to a certain extent, but not. We've prioritised all our patients, ones we're waiting to come in, and any urgent cases. So we will still see those people. So you don't need to worry about that. We're still running clinics. One of the things we've learned is how to run a remote clinic, and they're not going to be affected. So we can still do those, and we're looking at ways of improving those. We're open, and please don't be put off contacting us, worrying that that we're too busy. We're open for you.
Be in touch. That's already. You mentioned there, John, about remote monitoring and things like that. Can you just explain what that means? Because I know it means different things.
It's not
in practice at present.
It's not. Yeah. Okay. So we've all moved, but out of necessity to our clinics being based on either telephone or video. So that sort of comes under that. And then what can we do apart from talk in that? Well, talking is obviously very important because, we can find out how you're doing and how you're feeling. But there are some certain things that, would be good to measure and get from you. And I suppose that's what I mean also by remote monitoring. And that can mean just you giving us your weight or, changing your medications or any recent letters you've got, to filling out an emphasis 10 questionnaire, or even doing a 6-minute walk test, various ways. So, and working out ways of getting blood samples as well. So all those kind of things, so that we can make together the most out of these appointments.
I know, John, we've worked quite recently with yourself and the physicians group, the UK physicians group, and the nurse specialists in those centres of putting together this making the most of remote monitoring appointments, which is on our website. I think it was in the last Emphasis magazine. We're working with the home care delivery services who deliver drugs on people who've got pulmonary hypertension therapies, and they'll get an envelope with some of this leaflet in, and it gives some really practical advice about preparing for it. There's a copy, as you mentioned, about I think the Emphasis 10 magazine, some questions to prepare for when you have that telephone consultation, whether it was a telephone or a video or things like that. It's about engaging, because one of the things I think potentially some people worry about is that you can collect clinical data, so how far do you walk, what's your weight, etc. But a very important part of a consultation is sort of how you're feeling, that social type of thing, because that's really important, isn't it, John?
Yeah. Oh no, absolutely. And I think because these times are quite limited as well, it really does well to prepare and sit down before and think of all the questions that you want to ask, and also your friends and family might want you to ask as well, write them down and have them all prepared. And this form that you talk about, making the most of remote appointments.
Yeah, excellent, very good. We've got ones in up north, John.
Got it there. You know, sort of just reminds you about, you know, some of the useful things that you can do to prepare for your appointment.
I mean, it's all very practical stuff, isn't there, John, as well, about particularly in this period of time and going forward as well, because this is not just about how we manage and help support people with pulmonary hypertension in a pandemic, probably how we might better manage them long term. Things like making sure that you've got a regular weight, having a pair of decent scales at home, because that can be really helpful at times, just a very practical. So not only weighing yourself, but weighing yourself and making a record of it, making sure if you have got a clinic appointment coming up by telephone or whatever, you have a list of your medications that you're on, because they may have changed from last time, and those sorts of things. Very practical and really important. And I presume from your perspective, as you know, somebody having that consultation by phone, you'd find that really helpful.
Really helpful, yes. I mean, it's because the time's limited, and we want to make the most out of these appointments, and we want to try and get it as close to the face-to-face appointments that we had. You know, the wait was always just done, and so But it's something that as you say, you can do at home with a reliable pair of scales. Do it at the same time every day. You know, first thing when you wake up, for instance, when you haven't got many clothes on, or the same number of clothes, just so that it's reliable. And that's incredibly helpful, because that can give us an idea about whether you might be getting a little bit more fluid, and sometimes you might not be aware of it, but you can see that on the weight. So it's very useful.
Yeah, I think it's an important point there, John, as well, because I know I'm doing sort of 2 remote monitoring clinics a week as well now at work, and the weight thing always sort of just generates. It's one of those things that can generate a bit of an anxiety. We're not really interested whether you're putting on a bit of weight because it's a bit of a lockdown and you're eating too much pork pie, as I've been doing as well. It is about it's a way that we can sense whether you're retaining fluid, and that's to do with the function of the heart and things like that. So it's a very positive, and actually not only is it a way of providing us with information, it's a way that the individual themselves can take more control, can influence things better. It's being more aware of it, and if it's somebody that sort of struggles with that, so don't be afraid of using a member of your family or your partner or whatever to help you sort of prepare for a clinic. It's not something you have to do on your own.
No, absolutely. Yeah.
And do you think, John, going forward, that this in part, not exclusively, but in part, what we've learned in this pandemic, and by the time we start getting to some sort of normality, it would be 12 months at least, and I'm not saying after 12 months we're back to normal, but do you think this will be a way forward for part of what we do?
Yeah, no, I think it will. I think it's, you know, if you want to think of positives that come out of all of this, it is something that will help, because a lot of people travel a long way to come to hospitals, and I know that most people don't mind doing that because they value going to a centre, of course. But if we can cut that down for you, and we can use it effectively, then that can only be advantageous. So I think moving forward, certainly at our centre, and I'm sure other centres will look at being more efficient, if you like, when we see you face to face in terms of investigations and seeing you and making a plan. And then in between those times, which may be like a year apart or 9 months apart, in between that time, we can use these video or telephone calls, and so you don't have to travel to us at that point. So I think it will make the overall package of what we can provide better.
Yeah, and I think that's one of the potential. I hate sometimes when people tell me that, COVID-19, this is good stuff coming out of it, because it doesn't feel like good stuff at the moment.
No, I know.
One of the things that you might learn through all of this is some ways of doing what we were doing before better.
Yeah.
And we were looking at doing this sort of thing before the pandemic. This has just accelerated it.
Yeah.
put the
Yeah,
foot
no.
on the accelerator and doing it in that way, and using, you know, telephone and that sort of different. It's not really modern. It's like we're almost talking about telephone as if it's modern technology. It's been around longer than I have, John. Really, telephone by all accounts.
Talking of modern technology, yes, I've just, you know, this is my modern technology.
Yeah, that's
see,
old,
so
yeah, is that an old BlackBerry?
an old BlackBerry.
Yeah. Was that on Antiques Roadshow at the weekend, John?
It was. I think I might send it to the repair shop though.
Yes. Yeah, I've that emotional sort of that type of thing. So John, just to sort of tie up now where we're at, and I'm sure we'll probably need to come back in a month's time just to revisit things, not because I sense things will desperately get worse, that they're almost on this cusp. It's this critical, it feels like a critical moment because of where we're at with the new variant and the spread. But what we've got here is we've got some armor, of which is the vaccine, something to fight back on. Just to sum up, John, what the sort of thoughts are from your perspective as lead physician for the Brompton and lead of the PH service. One for pulmonary hypertension, but and being an honest sort of the next sort of what we're expecting the next sort of 4 to 8 weeks that you would think.
Well, I mean, the first thing to say is, despite all this, in terms of, you know, how kind of messages I'd like to sort of give. Despite all this, the centres are open for business, and I think it's really important that you realise that and don't be scared of contacting us. It's really important that we help you look after your pulmonary hypertension and all your other conditions if you have any other conditions. So I think that's really that's really important. And then the other is that hang on in there, because, you know, vaccines are here. You will get them soon. Some of you already started getting them, and that is a game changer, as all the experts are saying. It's a game changer. So there is really light at the end of the tunnel. The next 4, 6, 8 weeks are going to be hard, and you know, you've done so well at shielding up to now, and I'm sure you'll do it really well for the next 4, 6, 8 weeks, and then after that, I can see things improving, and we'll get out of this.
Yeah, I think also, John, you know, that's really sort of clear and encouraging. We will get out of this. We will get out of it. I think one of the things I feel personally at the moment on lockdown number 3 is that it feels so much worse because the weather's rubbish and it's the middle of winter. I was encouraged at the weekend though, just as a sort of glimmer of hope, and you know, the days the days are getting a little bit longer. It's saying a little bit lighter type of thing, and you know, I think when you're in lockdown as well, particularly if you're shielding yourself, your world seems very sort of much more smaller and narrower than it probably will be on the other side. I'm greatly encouraged by the vaccines. I know I'm involved in Sheffield. I've got the privilege of being involved in rolling out some of the vaccine clinics. So you see that positivity as well, but also being realistic, sort of speaking to people with pulmonary hypertension and how it must feel. I can't imagine what the last 10 months have been like. And you know, and it's not a patronizing thing to say we owe you a lot, and we're learning a lot from you. And it's for me personally, I'm greatly encouraged by the conversations I have with people and with pulmonary hypertension, the family members, etc. Not forgetting people who are, you know, connected with people with pulmonary hypertension. Just what impact is that? And it's really it's changed the way I think about sort of day-to-day stuff. And you know, hopefully post-pandemic, I'll see that very differently as well. So we've got a lot to learn together.
Yeah, absolutely. We've come a long way, and we're nearly there.